直接参加那个链接，但是大部分人不熟悉那个链接，所以很多人
对，
参加不了。
是的，这个没办法，因为咱们这个是学校组织嘛，这个必须是有一个注册的过程的，不能像咱们平常民间的这种，就是大家在 group 里面 share 一下，然后这个就可以来了，不太一样啊，因为这个牵扯到学校组织，然后都有哪些人参加啊，讲课的老师是什么，所以必须按照程序来走。那咱们现在就开始吧，好吗？如果大家都没有意见的话。
Okay, I'm
好，
ready.
好，非常感谢今天大家在百忙当中啊，这个有来参加咱们这个活动。这个活动呢，是我们已经办了好几期了，这个是 Mental Health 和 Wellbeing 的 Program affiliated to Singularity Academy。那在这个 program 底下呢，我们已经有5期，我们已经有10期的讲座，主要是针对 mental health 和 well-being。主要的这个讲课的老师呢，都是由我们学校的医院 Singularity Academy 底下有4家医院，都是在德国4家医院的这个医生呢来进行这个讲课。那这次我们也非常荣幸呢，请到王天伦教授，他在英国来给我们讲这个课。我要大概这个说一下，因为王老师是我一个崇拜的偶像。我当时读中医的时候呢，我就非常想上王老师的课，但是呢，这个我们那个学校呢，可能这个档次不够，也请不起王老师。
客气。
所以一直想听王老师讲课，没有机会。那现在真的是如愿以偿了，可以请王老师来讲课。那王老师今天主要是讲的用这种 alternative 的这种方法，因为我们知道在欧洲的话，我们主要是用西医的方法，精神科、心理科的方法来治疗这个 mental health problem 呀、mental disorder 呀这种问题。那其实在全球这个各个国家的医学当中呢，中医来讲是一个最系统、最 holistic、最 systematic 的一个方法。那这个方法如何解决目前21世纪最难解决的问题这个就真的是得向我们的前辈来学习了，得请王老师来讲一讲这个整个的一个大概的情况。因为我们这个活动呢，因为这个讲座时间不会很长，只有1个小时，再加上我们可能需要中英文都要结合起来，所以会比较 compact。内容上会比较这个比较简单一些。那后期如果大家期望能够学到更多的东西，我们也可以做一个线下的一个 program， 然后希望大家能到我们医院来直接来参加这个线下的这个培训跟讲座活动。那这个我大概 share 的这个 slides 呢，是我们的网站，这个网站上是我们的 mental health well-being 的一个 program， 这个 program 上面已经有10次了，加上王老师这次是第10次的讲座。那这个第11次是下一个礼拜的讲座，如果大家感兴趣的话，也可以来参加，是我们医院的医生来讲的，主要是讲这个 how to deal with your troubling emotion 大概是这个情况。因为我们今天也有几位这个 English speaking participants, so I will switch to English and do a very brief introduction. Okay, I thank you very much for several participants today who speak English joining our program, our webinar today. This webinar is part of the series of mental health and well-being webinar program organized by Singularity Academy from Switzerland and Singularity Academy's affiliated hospital in Germany. The hospital located in Germany mainly dealing with the psychosomatic mental disorders in Europe. So in this program, we already have 10 times of the webinar given lecture by our psychiatrists and medical doctors from our hospitals and scholars and professors. And today we're very, very grateful. We have our Professor Wang Tianjun from London, UK, joining us, gave us this opportunity to learn from him on how to use acupuncture and TCM dealing with mental disorder and well-being problems. And as everyone probably in the meeting today, Chinese, I think everyone know that Professor Wang is very well known acupuncture and TCM professor in TCM field. And he is one of very few acupuncturists and TCM practitioners who is able to use acupuncture treating mental and brain diseases and problems. So in my time, when I was learning TCM, I always want to join Professor Wang's lecture, but unfortunately, my home university, had no opportunity to invite Professor Wang to join us and give us lectures. So for me, it is a very, very great opportunity today to learn from Professor Wang. And now I give the floor to Professor Wang. 王教授，现在您可以开始给大家做讲座了。
Okay, thank you. Yeah, thank you for Dr. Zhang's introduction. So now may I share the screen? Yeah. Okay, share screen here. Yeah. I think you all got my shared screen now. Okay. Thank you everyone to join today's public talk about the depression, the overall depression, and we say the feasibility of the TCM acupuncture for prevention and treatment. So as introduced, my name is Wang Tianjun, and from the UK, London. Very briefly background for myself. Some of you are familiar, some maybe not so familiar with me. So yeah, I got my Chinese medicine education from Nanjing University of Chinese Medicine in 1989. So you can see this year is exactly 35 years in this career. I also completed my PhD 2008 for acupuncture for depression. Yeah. Currently, I'm the principal of London Academy of Chinese Acupuncture, LACA. I'm the guest professor of Nanjing University Chinese Medicine and the president of the Academy of Chinese of Scalp Acupuncture UK. That's a very briefly background. And now we move on to the depression itself. First of all, I will start to have this points we call the two extreme points. 我会说，在抑郁症的公众之中，以及抑郁症的咱们中医大夫的这个讨论过程中，经常会出现两个偏激的观点，to extreme view。有一个观点认为抑郁症非常简单，中医治疗了很多年的经验，认为这是抑郁症就是心魔干预心神，就是想多了我们可以用针灸、中药、拔罐、按摩、太极气功去治疗所以有些大夫很信心。Depression is very simple. I can treat many of them. 但另一种观点认为，就是真正的抑郁症，尤其是我们叫做是 major depressive disorder， 就重症抑郁症非常严重。有些特别是一些老的中医大夫，他们曾经治疗过真正的抑郁症，但是呢，就是效果不是很理想，甚至可把自己都搞到抑郁了。所以他就会认为中医治不好，治不了抑郁症，弄不好把自己就给搭进去了。而且他认为这样的病人有病气很严重。后面我们还讨论病气的问题，所以这两种观点，我个人认为都是片面的，他常常是把第一个观点认为把抑郁和抑郁症给搞混淆了。抑郁就 stress， it's very common, very very popular. It's a very good response for general Chinese medicine acupuncture. But the major depression， 真正的抑郁症确实是很难治的，但是又不像第二个观点。像有一些可能没有经过抑郁症的培训的一些咱们中医大夫说的，抑郁症中医治不好，这也是我不同意的，是完全可以治好抑郁症的。So now the overall of depression, there are several points of view about depression. First of all, depression is very common, worldwide, roughly about 5% of the population had some level of depression, and it has been seen. It has been we say distribution in very different age, different background, different education. Whatever you are poor, you are rich, what are your well-educated and the lower educated, they all could be happened. Yeah. And or nowadays, by the figure of World Health Organization, depression is the first the reason for disabled. And depression, in depression, the population, the female around 70% and the male 30%. That is the very basically. And the most the severity of depression for the cause social damage, depression can cause suicide. Finally, there are around 10 to 20% of the major depression patients suicide in finally, if without the correct care. But depression could be treatable. It's treatable. It could be prevention as well by general medicine and Chinese medicine. So that's very basically. Nowadays, I think we almost every year, every country, we can find some news about the big names, the suicide every year. As a big sample, last year, one of the famous famous star called Li Wen, and she was known by most of the Chinese people in the Western country as well. She was noticed by her famous smile. She always showed her as a smiler, happiness go for public. But unfortunately, last year she was found suicide in her sister's bathroom. Suicide. So it was a big news last year for this. So if you can see, there are almost every year, every country, every side, there are big names. The big celebrities commit suicide. Suicide, not only these celebrities, everybody, every country, every suicide, depression patients, they may found in different age, different name, but because they are celebrities, they generate a big news on public. They give the society, give not only themselves, their family, but the whole society a big pressure, a big pressure. So you can see, I list some of these famous names. In depression, there are several different types of depression. They could be original depression. That means they have no any preview condition. So most of the time we call this is the real depression. But there are several other secondary depression caused by something else, such as the stroke, after stroke depression, naturally 产后抑郁症、中风后抑郁症, and brain trauma, after brain trauma depression, etc., etc. Many of them could be rehabbed, and there is a special type of the condition very similar to depression, but we call the bipolar disorder as well. Also, depression has different stages. They could be in early stage, mild depression, could be in the moderate or middle stage of depression, and could be in very severe depression. Yeah, when we talk about the general treatment of depression, most of the time we say there are mildly cases, but in the moderate or severe depression, we need more professional or more care of training and treatment. In terms of the identification or diagnosis of depression, of course, there are several different diagnosis methods. But as a clinical speaking, they will say, as a clinical practitioner, such as our overseas acupuncturist or TCM practitioner, normally we'll say we make a clinical diagnosis of depression. We'll say there must be at least 5 of the following symptoms for a period of at least 2 weeks. So this is a clinical declaration based on the American the Society of the Psychologists, such as depressed mood most of the day, nearly every day. That should be at least 2 weeks. Markable diminished interest in pressure in almost all activities most of the day. Significant weight loss or weight gain without a diet. Yeah, or major changes in appetite or eating habit. Yeah, insomnia or hypersomnia nearly every day. Yeah, psychomotor agitation or retardation. Fatigue or loss of energy nearly every day. Yeah, feeling of worthlessness, guilty, desperation, and psycho pain that are ongoing. Inability to think or concentration. Yeah, they are one of the key problems is a concentration problem. Yeah, indecision every day. They can't make a decision every day. Finally, recurrently thoughts of death or suicide, or specific plan or attempt to. So if a patient come to see us with this, at least 5 of these symptoms, we may make a clinical diagnosis, not a professional diagnosis or official diagnosis, but make a clinical diagnosis where they are very possibly suffering from depression. Yeah. But of course, if we're doing clinical research or professional and expertise diagnosis, we need some the depression scale or questionnaire, such as most commonly used during my PhD. I used to call the Hamilton Depression Scale. We use this questionnaire to make the professional diagnosis. For English, there are similar scale and something else we call the PHQ-9 depression, the questionnaire. We make the diagnosis as well. And for clinical speaking, the depression, they have some typical symptoms, such as persistent depressed or lower mood, usually lasts more than 2 weeks, inability to experience emotion, and inability to express emotion. They can't express in person, such as they are very, very rare to use the word enjoy. They can't enjoy any lucky, happiness, etc. And they are severe lack of energy, decreased cognitive activity, physical and mental activity, etc. etc. Yeah, these are, simply speaking, they are classification symptoms. Now they will move on for the general treatment. First of all, from the Western medicine, the doctors, the psychiatrists, etc. So most of the time they first start from the psychiatrist, psychotherapy, and most of the time was counseling, or one of the special counseling called cognitive behavior therapy, CBT. They can help many depression patients, particularly when they are in early stage. But if they are not good response for this kind of the speaking therapy and the CBT, etc., then the antidepressant will be the major selection. Nowadays, the majority antidepressant used worldwide is we call it SSRIs, which represent to selective serotonin reuptake inhibitors. Yeah, there are 5 of them are mostly commonly used, such as fluoxetine or Prozac. That is translated in Chinese. There is a name called 百忧解. The formal name called Fuxiding, but the common name called 百忧解. From there we can say, wow, 百忧解. That means all the worries or mood can be sorted, etc. But there are something else. All this SSRI and the antidepressant has the similar mechanism, which is regulate the serotonin level in the brain, 五羟三水平. Yeah, this is based on the most of the clinical research to indicate the depression. One of the major mechanism is the serotonin level in the brain damaged. So this medicine can help to increase or regulate the serotonin level, and for roughly about 55 to 60% of patients can be good response by this kind of antidepressant. unfortunately, although it is well developed, still lots of side effects. Yeah, the common side effect for the antidepressants, including the first of all, it's the delayed onset, or you can say 延迟起效. During this delayed onset, suicide cases increasing. So when the patient first take the antidepressant for SSRI, many of them will experiences the first 2 to 4 weeks, they even feel worse before they're getting better. So if the patient couldn't tolerate this getting worse, or the doctors, including the comprehensive or alternative practitioners such as acupuncture, TCM, etc., we don't understand this mechanism or did not give them enough explanation or support, the patient even worse. They can't tolerate medicine, they can't continue the medicine, and even the suicide cases could be increased in the first 2 to 4 weeks. So this is the major side effect for this medicine. And of course, there are some other side effects as well, yeah, such as more anxiety, nausea, poor diabetes and diarrhea, headache, insomnia, etc., etc. These are the common side effects of antidepressants. So based on the characteristics of depression, there are 3 higher and 1 lower, we call the 三高一低. The first high is a high incidence of disease. Very, very common now. The depression is the top 1 and the disease on the mental health, yeah, and one of the major disabled disease worldwide. So it's high incidence. Secondly, is a higher relapse rate. They are very getting relapse. Some patients are good controlled by medicine, but not good continued treatment. They could be very quickly relapsed in a couple of months or years, and very high suicide rate compared to other mental health or physical or neurological diseases. Depression is the most higher suicide rate. As I said, roughly about 10 to 20% have some level of suicide activity. But unfortunately, the lower rate of visiting doctors and dismit. Based on the NHS, the UK, the analysis, less than 25% of depression patients received formal treatment from doctors. Yeah, and much less of them received the TCM or acupuncture treatment. In other countries, such as in China, even lower than level of this lower visit. And how to dealing with depression, how to understand depression, how to treat depression. I also cite some of the celebrities with名人talking about depression. And most Chinese people know a famous TCM, the famous TV presenter, we call it 崔永元，他被称为是中国最著名的抑郁症患者 because almost all the Chinese people know he was suffering very severe depression. Finally, he was lucky treated by a combination with Chinese medicine and West medicine. Finally, he said, to find a good doctor to treat depression, it's very important. And secondly, a famous movie star said, 一定要有勇气去看医生. You need to brave enough to find doctor. So some of patients are shy to tell public they are suffering for depression, or they are very, very lack of confidence to find a good doctor. Yeah. In terms of the treatment or the prevention of the general TCM, of course, based on the previous 2000 years experiences, and we have lots of good experiences and a good treatment plan for general depression. We can use the herbal medicine and the acupuncture points for depression, or depression, the similar symptoms or depressed symptoms. Yeah, I list of them. I particularly for today because it's not specific for treatment detail. So just list them for your references. So for generally speaking, for the early stage or the mild cases, this treatment are quite good for them. So we can continue following this treatment procedure. And for the generally speaking, the experiences for TCM for depression, we need to think about depression patients are mostly combination of mental and physical symptoms. Even many of the depression patients come to see us start from physical symptoms at the beginning, such as headache, such as the neck pain, back pain, lower back pain, etc., etc. So they are by biomedicine and society, and also in different stage of depression, early stage, middle stage, late stage, and the individual patient. We need to think about how to use acupuncture, home medicine, or Western medicine together. Yeah, there are some of the traditional TCM formula can help for depression. Yeah, such as the 月季丸, such as 柴胡加龙骨牡蛎汤, etc. We may think about. But unfortunately, one of the famous Jing Fang from Shanghan called the 柴胡加龙骨牡蛎汤 is the commonly used the formula for depression for many of the Jing Fang practitioners. But unfortunately, some of the major the herbs in this Jing Fang, we can't use it in the Western country, such as 龙骨, 千丹, even 牡蛎. So that is one of the disadvantages we practice Jing Fang in Western countries. Now we move on for the general speaking, the how to treat the major depression disorder or for the severe depression. Now I'd like to very briefly introduce some of the new developments of TCM for major depression disorder. So which means in the last 30, 40, several decades, now TCM and the Chinese and the acupuncture has developed its theory and the techniques for treating depression. Not only the classic TCM. Classic TCM has good job, but not good enough for some patients, particularly for some severe patients. This is part of the reason some of the senior TCM practitioners said depression can't be treated by TCM because they have treated some severe patients with the classic TCM treatment, such as 肝气郁结, liver qi stagnation, heart shunt disorder, etc., but not good response. That's part of it. That means their knowledge and skill are not good developed. So nowadays, the development of TCM theory and treatment nowadays focus on the depression is the majority of the location of depression is in brain, not only in heart, in liver, in spleen, etc. The majority is in brain, but related for 5 Zhang organs. Yeah. So the for brain, they are developed on the brain patterns, which can help us to treat these brain diseases, such as we say the brain yang qi xu, brain deficiency of yang qi, brain shunt disorder, etc. For detailed treatment strategy for milder cases, we mostly use the home medicine, acupuncture, 推拿 massage, cupping, taiji, qigong, diet therapy, etc. They are quite good for general early stage. Yeah, but for moderate and severe cases, they are not good enough. So we can think about to use the brain theory. We can choose the scalp acupuncture. We can use the brain channel, which is the 督脉 and the 任脉, governor vessel and the concept vessel to treating these kind of patients. Yeah, and commonly used scalp acupuncture areas, including the spread emotion area, central area, foot motor sensor area, head area, manual control area, etc. Yeah. For the 导气 technique on 督脉 and 任脉, we need to use the gently, mildly, and long-lasting technique of 导气. Of course, we may use some other technique as well, such as the 治三针, etc. Yes. So these are the principles. Because today is not, we say, the typical seminar or workshop. I do not spend too much time on detail. I just give you some principle and idea how to treating severe depression. Yeah. Now we move on for one of the common questions: why acupuncture, particularly scalp acupuncture, can help depression, can help brain conditions? There are some mechanisms, such as they said the channel theory. We can think about, okay, some of the channel related for the brain. We can use the biohydrographic hypothesis. Yeah, and majority nowadays, most of the academic believe the brain knowledge, particularly the scalp acupuncture, can help many of the brain conditions, including mental disorder, is the stimulation for the cortical functional area, which means when we stimulate such as the spread emotion area, it is located just above the frontal lobe. Frontal lobe, as we know, we know it is a major area to regulate and control our behavior, our cognitive, our concentration, emotion, etc. So when we stimulate this area, it can directly to stimulate the brain, the function, which is also connected for nowadays one of the topic high technique called brain-computer interface. As you can see, one of the style of the brain-computer interface is we call the non-invasive BCI， 我们说叫非侵入式脑机接口。各位知道，脑机接口现在是全球发展最快的一个科技行业，也是医学行业。它可以帮助很多这个以前认为不可以治疗的病人重新获得他的脑功能，包括他的这个情绪病变等等。而脑机接口的一种非侵入的，就是在头皮表面放上一些电极来接收信号，并且产生刺激。这点上跟我们的头针就非常相似了。头针就是在头皮表面来通过刺激方式来调节脑的病变。So the brain-computer interface give us an idea to understand why scalp acupuncture can help severe the brain problems, including severe depression. Yeah. Nowadays, when we treating depression, we mostly use the acupuncture plus antidepressant. So, which means in most of the cases, it is an integrated medicine, which means integrate of acupuncture or Chinese medicine plus the Western medicine antidepressant. But what's the advantages? What's the benefit of this combination or integration? Which, based on my PhD research, as you can see, I show this picture called the Nanjing 脑科医院. English is Nanjing Brain Hospital. I spent nearly a year time in this hospital. This is the typical Western medicine hospital. They mostly use the psychotherapy to treating patients. But in this hospital, I did nearly 1 year time to research how to integrate acupuncture with antidepressant treating severe patient inpatient department, which is severe patients. So the old patients are divided into two groups. Old patients receive the typical antidepressant, SSRI, but half of them randomly choose, half of them we use plus acupuncture. Well, that means we combine with the medicine plus acupuncture compared with medicine only to see. Then the final result showed the benefit of acupuncture plus the integrated Western medicine is the first, it can faster result. As we mentioned previously, one of the side effects of the antidepressant is the delayed onset. This can make the patient in the first 2 to 4 weeks, they are even worse. But combined with acupuncture, both patients are faster result in 1 week. Yeah. Then the treatment can last more longer, less side effects, and cost saving, etc. And also it can help the patient a better well-being and general health, etc., etc. So that's are the majority of the benefits with integrate Chinese medicine, acupuncture, and the antidepressant. Some of the personal experiences to share with colleagues. First of all, is after so many years treating severe depression patients, as you know, during my PhD research in China, I have treated more than 100 severe depression patients in hospital and hundreds of general depression. So based on this hundred of patients' experiences, I summarize some of the personal experiences to share with colleagues. First of all, 对于重症的抑郁症病人做心理疏导不能随便做。我们有些人对自己的亲戚朋友或者病人给他做一些辅导，哎呦，你担心什么啊？你家里条件这么好，你这个老公对你这么孩子这么好，也这么好房好车，你为什么还抑郁呢？让你老公给你买个包，让你们去做个家就好了。这种情况我们说起来，对于普通人来说也许是个安慰，但是对于抑郁症病人来说，常常是更加重他们的病情，加重他们的负疚感，弄不好适得其反，一定要小心，不能轻易做。如果没有经过培训的话，没有一定的知识的和培训的技能的大夫，最好不要轻易的接诊重症抑郁症病人，有可能不仅治不好，反而影响到自己。这里就说一个病期问题。我们有一些中医大夫讲，哎呀，今天我治疗了一个抑郁症病人，我自己觉得我自己都病了，回来以后我自己都很抑郁，我自己觉得病得不轻。这种情况常常我们有中医大夫认为这是病气。实际上，我个人认为，从真正的我们说到这种physical的病气是不存在的。它所谓存在的病气，是因为自己的正气不足，我们讲正气存内，邪不可干。If we have a good enough healthy qi, no any evil qi. But on the other hand, if our internal healthy qi is not good enough, and we are not so confidently with the mental health knowledge and skill, we may impact badly by the depression patient. So we need more careful. Yeah. 另外不要轻易的要求病人或同意病人停药。我们可以建议，但是经过一段时间治疗，病人好转以后，我们可以建议病人可以考虑逐步停药，但是需要得到专科医生同意。We need carefully do not suggest patient to reduce or stop the antidepressant. Otherwise, it could be a very big problem. There are many cases. 另外有些重症抑郁症病人好转以后，但是反而自杀了。所以这样的治疗我们要提醒，特别注意这样的回光返照。我遇到过好多例这样的病人，我自己遇到，还有我的同事都遇到，一定要特别小心。Also, I'd like to give some, we said prevention suggestion. Yeah, the first important is the sleep. Sleep is the first prevention method for for ourselves and for patient as well. For depression patient, it's a priority. Yeah. Secondly, it's diet. Diet should be balance. Yeah, and balance from the from the 5 elements, balance from yin and yang, different color, etc. And also exercises, very important, particularly outdoor exercises. They can help us to generate more brain serotonin. Yeah. And next one, we suggest to make friends, close friends with the positive thinking friends. Yeah. We do more volunteer job. We suggest to more study, particularly new study of the new skills. Suggest to more laughing. Finally, we personally more positive thinking to make friends with positive as well. And in terms of my knowledge, I have already published a special book called Acupuncture for Brain, Treatment for Neurological and Psychological Disorders. In this book, I have already detailedly explaining my brain knowledge, brain the techniques such as scalp acupuncture, Dao and of course, the treatment, including the depression and other mental disorders. If anyone are interested for further, you may find this book published by Springer. Springer 中文叫 Springer， 它是全球排名前几位的一个在医学和自然科学领域的重要的出版社。其中有超过200位的诺贝尔奖的获得者在他出版社出版书籍。 我很荣幸的这个出版社跟他合作出版的这本我的这个英文专著叫 Acupuncture for Brain， 叫针灸脑病学。每一个病包括 depression 都有它的 general information from West medicine， TCM understanding from operation， general acupuncture treatment， unique brain acupuncture treatment， 另外还有一些 research 的 background， 还有一些 reference， so 可以作为参考书。下面呢，根据时间情况呢，还有一点时间给大家介绍几个应该算典型案例吧。We can see and hopefully we have time to sample some sample cases. The left side of this lady, she is acupuncturist. She's suffering from depression more than 2 years. She can't stop her job. She continued. She has already tried many times of general acupuncture by herself, her colleagues, her supervisors, but unfortunately not great. Finally, she saw my paper published. She contacted me to see me in my clinic, and I start to use the 督脉导气 technique. You can see the 督脉14 and the 督脉14大椎 and the 督脉16风府. Yeah. The first session, he already got a good response, and finally she recovered back to normal life. On the right-hand side, a young boy, he's 25 years old. He's suffering from depression more than 5 years. He couldn't continue his uni study and back home. I was invited for a home visit to treat his grandpa of the dementia. It's getting better. Then he refused the acupuncture treatment, but finally accepted. I start to treat him with the Renmai, including the abdominal acupuncture and the scalp acupuncture. Yeah, he getting much better as well. So that's the very briefly introduced. And I have also published several the video on my YouTube. If you are interested, you can find this link for your YouTube of patients, such as this lady suffering from severe depression patient more than 10 years. After the first session, he got much better, and she accepted the text this video for my the YouTube. And this is a very severe depression patient suffering from severe hallucination several years. You can see that I would recommend Professor Wang without hesitation, even if you have tried acupuncture previously and not had the result and that you will have hope for. So she has tried acupuncture for local acupuncturists, but unfortunately not great. Then she said suffering from mild to severe hallucination in the first hour sleeping many years. They can be very frightened. I found that the frequency and the severity of them eased immediately after seeing Professor Wang, and the progress has been excellent so far. The difference between now and how it was extreme. I cannot sleep for an entire night with no hallucination for days. Yeah, it is incredible. I tried many different remedies over the years, including acupuncture with different practitioners, and nothing has helped. So etc. And this it's a young student. She's suffering from nightmare for 10 years. Yeah, also after 1 or 2 sessions, she has already. I could fall into sleep deeply, and after second time, I could feel that my life come back to my childhood without any pain. I guess I never believed this miracle moment if I had never taken the therapy by Dr. Wang, etc., etc. Yeah. So just some very sample cases for your reference. Finally, a little bit of summary, and now I'm happy for question. First of all, the depression is very common, and depression can leading suicide. Yeah. Depression can be treated. We use antidepressant. Should be very carefully to use it, to start it, careful for its side effect, and not so simply to reduce it or stop it. Chinese medicine can help depression, particularly brain acupuncture, help for severe depression. We need to promote and public notice for the prevention and the treatment method for depression. Okay, that's all for my talk. You are thank you for listening, and you are welcome for questions.
，Thank
好，
you，Thank
我的讲座
you，
结束
Thank
了
you
啊，欢迎大家讨论啊。
好，谢谢王老师啊，谢谢王老师在这么短的时间内，就是给大家基本上把所有的内容都已经 cover 到了。您那边就点一个 stop share。
对，我看看怎么哪边找的 stop share，哎，奇怪，怎么打开这东西？啊，这东西突然怎么出现打开？奇怪啊。
没关系，您可以先那样放着，没关系。
我应该可以打开。奇怪，我怎么突然哦，这边的，好了，可以了。
哎，好，就是非常感谢您啊！这么短的时间，让把这是一个世纪全球问题，让您在1个小时之内把它全 cover 到，真的是很困难，
而且还硬看对照。
对，非常不容易，很感谢。就是因为咱们学校这个底下这4家医院都是主要是治疗这个抑郁症的，当然您说的那几个问题我们都遇到过，比如说尤其是这个重症抑郁症，这患者真的是非常难对付啊。那个有一个问题其实困扰我很多年，就是说其实中医治疗抑郁症啊，虽然我们是开西医医院的啊，但是中医治疗抑郁症其实是非常有效的，但是很奇怪，为什么在国内大家都选用西医来治？
这个问题怎么说呢？比较复杂吧。这个在国内也有用中医治的，就包括像我讲的南京脑科医院，他们有针灸科，他们也用治疗一些，但是总体上讲都是以中西医治疗为主啊。这里面有法律的问题，有这个伦理的问题，也有一些像主流，你知道，在全世界嘛，都是主流的是西医占主导嘛，它西医的话语权问题等等各种因素，所以目前在全球都是以西医治疗为主，有一部分地区适当的配合中医治疗，这个是有的。
对，其实这样的话，对，你看在国内都是这个状况，其实对这个在国外的中医的这些医生也是一个挑战。怎么样在什么样的时间啊，以什么样的话语，然后来告诉病人，哎，你应该这样去治疗，其实是很困难的。你像在我们医院里面，其实呢还好一些，就是有很多病人他会主动来说，我想用针灸治疗，我想用中医治疗，因为可能觉得，哎，试一下 alternative 也不错，效果也很好。但是对于这个，比如说他整个的医疗系统啊，对于这个保险公司啊，却不是一个好事情。他们当然是不愿意给这个中医来付保险，说，哎，你就拿这个治这个病吧啊，那大家都是拿西医来治嘛。所以像我们医院愿意把中西医结合起来治的，在德国也不是很多。
对，已经非常非常少见了，已经做得非常棒了，已经是
对。但是我们也有困难，就我们的困难就是，其实他保险公司他是付这部分的，
对，
我们等于说是白送给病人来治疗。然后
这点可以分享一下在英国的情况。英国呢，首先条件，英国大部分的病人都是自费的。Most patients they are private payment, but there are some patients they have some private insurance. They can cover some of the acupuncture treatment.
对。
But whatever you treat depression or back pain, they just say it's acupuncture. So they can, some insurance companies they accept the acupuncture.
对，这个跟保险公司也有很大关系，但是你像大部分的公立的保险公司它是不 cover 的，所以我们有些病人他来找我们医院的中医来治疗的时候，比如说有 insomnia， 他晚上睡不着的，或者做噩梦的这种，他晚上西医能用的办法全都用了，能用的 therapy 也都用了，我们后来没办法，只能用针灸来治。
对，
最后针灸治完了以后，他当天晚上就睡得非常好。
哦哟，太棒了。
对，就第二天的话，这个病人看见我的时候都差点给我跪地上了。
是，
我还没有睡过那么好的觉。所以我就是其实这是一个很有意思的，就是你其实一针下去，你用针灸可以解决的问题非常 economic， 非常
对
非常这个不能说 cheap 吧 effective。
对。
但是呢，我们还是要跟着主流用这种西医来治。
这个是一个在西方国家一个非常这个棘手的问题吧，也是个现实情况。所以我们也觉得受很多限制，这也是真没办法。
对，我们当然还有一个病人我可以跟大家这个就是分享一下，就是有一个病人，他从小他这个 accident， 然后他用了很多的西药，但是他没有抑郁，他用了很多的西药，他也是一个体育冠军， 但是他最后因为受伤没有办法再从事自己的工作，接受了很多的西医治疗，然后尤其是注射呀、静脉注射呀，他看见针头他就不愿意，他就不愿意接受，但是他看见针灸的针头他没问题，他可以接受针灸，他不能接受这个其他的针，
注射器针头，对，
这个其实是蛮有意思。我觉得像今天有很多我们海外的这个中医这个 practitioner，其实我们大家都应该应该这个集思广益啊，然后大家可以聚在一起，好好的可以做一些 lobby， 看怎么样可以把这个中医啊、针灸啊，真正的可以把发扬光大，可以帮助更多的人。
对，欢迎讨论。
对，还有没有哪位朋友有问题？欢迎大家提问。
王教授，这个主持人好，我这边想问一个问题，我是做这个中医诊断这个研发的，然后我们是考虑的一个产品呢，就是做这个炙热感度 （thermal sensitivity）。
听说过。
Acupoints 就是说警穴的这个这个
是对。
对，王教授肯定是专家。我们在和国内的一些这个少数医生合作做这个抑郁症的这个案例，因为抑郁他们就是警穴是跟这个精神类的疾病关系很密切，所以我们有很少数的医生呢来做，他们发现其实对抑郁症效果很好。但是我现在因为还在样品，就是之前的产品不够好，现在在做升级版。升级版之后，我也想可能找一些医生，现在可能初步看到北京、上海的医生来做一些这种做一些小规模临床吧，因为这个资源有限，只能做小规模的。这个但是我想问一下，请教王教授，就是说，因为炙热感度好多年在国内其实没有开展起来，就您的这方面有什么这个看法和指导？
这样子这个问题可能比较不是直接跟这个今天讲座相关，因为比较复杂，我们可以私聊，你可以有兴趣了解。但是我知道，我可以告诉你，我做过这个项目，30年前我就做过了，在国内我就做过了，这个也有一些个人体会，有机会我们可以私聊吧，好吧？
好。
你可以加我的微信，你可以加我的联系方式啊。
好，谢谢。
好，谢谢你的那个。
其实他这个产品我在德国也看见过，但是可能不是那种热疗，但是他们是把热疗和
炙热感度，他就在这个手指这个12警穴，然后来探测这个，对，知道一些东西。
对，其实完全可以，你考虑一下，可以在。
Ich habe gerade gekauft und ich wollte 2 andere, kann ich retourgeben und ich habe vergessen zum Ausdrucken.
这个你有问题吗？
是个像德语啊什么的，听不懂。
还有没有哪位朋友有问题？咱们今天很多的同行啊。
对。
王老师你好，你的这个杨春平。
杨春平你好，请说。
谢谢今天很 systematic 讲了这个抑郁症啊，各方面都挺好。我只想问一下，就是在这个治疗抑郁症中，你提到大椎和风府导气啊，能不能稍微详细讲解一下这个导气在这个抑郁症中的应用？因为我觉得这个可能也是比较关键的，能详细讲解一下这个技术点？谢谢。
这个我觉得这个就比较困难了。这个我们跟王老师也商量了，下一次王老师有时间的话，然后直接到我们医院来，然后做一次线下的讲学。这样如果大家有时间的话，可以到德国来，就在法兰克福附近，然后我们可以明年挑一个春暖花开的时候，然后大家可以就把王老师压在那儿说教。
这样子，强行说不太现实，然后简单说几个观点吧。第一个，为什么选以督脉为主？一般我们以往治抑郁症都是常讲肝经啊、心经啊这些比较多，选督脉为主的一个理论，就是中医的发展一个重要理论，就认为督脉是脑的经脉，督脉直接通脑，所以以督脉穴为主，这第一个就是所以选大椎和风府，而风府穴是督脉的一个最主要的一个要穴。它是督脉进入脑子里面去的一个关键枢纽，所以以风府穴为主。而风府穴这个项目又是一个比较相对有一定风险的地方，所以选风府穴一定要经过专业的培训才能用这个风府穴，特别是要扎到治疗督脉治抑郁症的时候，一定要针的深度要在 1寸以上才有效，1寸以内是没有什么效果的。所以在1寸以上呢，就要有风险，就要经过特殊的培训，这就叫做我们要导气针法。导气针法呢，一定要面对面的培训了。首先你可以看我的书，看我文章里面介绍过一些，但是呢，具体针法一定要手把手的面对面的教，你才能学会，不然的话这是不可能学会的。就这几个观点啊。
好，谢谢王老师。
谢谢王老师，期待你的那个。
行，欢迎。明年我就有这个关于导气方面的这个讲座讲课。
王老师您好，
哪位？
我想问一下这个导气，就是这个导气的话，应该还是要有一点点，应该还是有一点，就是咱们的这个中医的，就是咱们在这个就是气，就是因为导气的话，应该就是那个天天一气这个气吧，应该是这个吧，这个气吧，对吧？应该还是咱们有一点，就是咱们要去通过一些站桩啊，这些方式要把真气储存了，才可以在病人的这个身体中再把随着针的这个导进去吧，是不是？还有这个来上，是不是？
对，你的意思，我部分同意你的观点，就是作为医生，我们自己身体要有足够的气，我们自己身体要健康，你才能治疗这样的严重的病人，这点我同意的。但是这个导气不是说把你的气导给病人，是调动病人自己的经络之气，
是
经络之气，然后呢引导这个气到他病的地方，叫做气治病所，就是引导这个督脉的气到脑子里面去，来治疗他脑病。所以这两点我们叫督脉导气。这就要需要你对他的解剖知识、对他经络知识以及你的针法，要经过专门的训练，才能做到这个真正的叫都气治病所，引导这个精气到他的病的地方去，这叫导气。
明白了，谢谢您，谢谢。
谢谢陈大夫。
还有哪位朋友有问题？因为咱们现在已经2点09了，瑞士时间。如果大家没有问题的话呢，那这次就到这儿。
我刚才那个加一下那个王教授，我李欣刚才加你那个微信加不了，说你这个用户不存在，你是 DRTJT WANG 对吗
？DRTJ TJ Wang DRTJ WANG， 你可能是不是加错了？
OK， 因为你 PPT 上个 T，OK， 那我用
可能我打错，对不起，可能我PPT 打错一个 T， 就 DR 就 Doctor， 然后 TJ， 然后王 WANG 王。
OK， 好。
就可能打错一个字了，对。
找到了，谢谢。
找到吧？好，谢谢啊。
那王老师，您看您还有什么 summary？
summary 你说吧，你主持人你来说吧，我该说的话都说完了。
还是非常感谢大家啊，这个来参加这个研讨会。然后后面我们希望明年有机会能够请到王老师线下来给我们亲自教一下。这个比如说王老师说的几个方法来治疗，然后线下的话，同行也可以进行交流。后面的一些活动呢，后面的一些 webinar 也是关于 mental health 啊，然后 mental disorder well-being 的。如果大家感兴趣的话，可以到我们起点学院的这个网站上面，然后我在咱们的 chat 里面也放了这个链接，大家就可以看一下。我们基本上是每周都有这个活动，2周是德语的，2周是英文的。那英文的期间呢，也会有中文的翻译。受众群体一般情况下是对这个话题比较感兴趣的一些朋友，当然也有一些专业人员，比如说像我们今天就大部分都是专业人员，专业的这个 TCM 的人员。希望大家可以积极的、踊跃的参与到我们这个活动当中，能够帮助到周围更多的人，这也是我们的一个初衷了。希望大家线下可以加强联系，互相鼓励，互相学习。好，那我们今天就到这儿好吗？
好，谢谢张博士，
谢谢王老师
谢谢邀请和主持，再见。
谢谢，好，
欢迎各位朋友 ，Thank you for everybody， 拜拜。
Thank you everyone，
拜拜。
谢谢王老师，谢谢王老师，
谢谢各位，谢谢各位啊，有机会再聊，拜拜。